Really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT 1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT 1179663.
World Remit, a better way to send money. Download the app or visit worldremit.com.
Period. During this period, any little savings helps. World Remit knows how hard you work for your money and are making it easier for you to support your loved ones. World Remit prides itself in offering you a fast, simple, and secure way to send money abroad from the comfort of your home, using a computer, a smartphone, or an app. If you are a new customer, enjoy your first 3 money transfers with no World Remit fees whatsoever. Use promo code 3FREE. World Remit, a better way to send money. Terms and conditions apply.
Mpeni kanya omwa se enye obi bribi eni obi na mo obi bribi eni ya wa yi abusia bread se ni so bi bedum aboa ama kakra mfa na oni akono dwene ho nipa well remit eni ne dia eye titu efa sikasem oni mo abebre se modi wadwuma den ene modi biara wobo se obema ififo nso ehu ahenha won ene nti well remit ede enhihye pa egwa kwamu se wobetumi edi sika amane ififo ewo abefo ekwan so computer smartphone anase app a ohaw biara enihu se woye new customer anase eyini dia edi kan ko ade a atagye wate denne ene se wobetumi amane sika free bonto a untua ehwohwe ema well remit sa ne prince aso 3 times umpewe na open tie ene gesem ene se wobetumi amane sika akosi MTN anase Ghana network biara so a how biara enihu well remit we yes samen shampa.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp SMS IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, Yamamu Akwa Baba Alco Radio. So, I health and wellness and our so good so wutie. Safina do a feeding out to her fair and yesterday. One message. And then Uncle Ponce, so boy on by and our side, the course idea babio. Yes, I do Sunday say at the most important show in the entire world, the most authentic show. I will be some Hanyanano, I know, any Akko health and wellness show. Yes, I don't know. Apple de hon some yes. We so na enu Mohammed and so Adine update from Ghana in terms of health coronavirus no yene Dr. Cletus Baidoo and I between komo I said no ya started that you can cancers ho asem na your mother general overview no you really know you can friend say breast cancer last 2 weeks you can breast cancer ho asem afirst so you can remember there no so as so ho asem ti ne na there you be pancreatic cancer so ho asem and say the no for na only some friend ni na some friend ni amunyina mumbra never show no enye na enye fe because information we no enya dey ye ton mo obi a and I was just ton kra na kan board pa because o dey me imagine say we consultation kra or doctor's officer send your bejo o dey just imagine na we runya do nyina for free nti bomodun asa wo be share na ma obi anso a share say dey be ya betuma bo ma dwumadi no akoso bebrebe ya da mu nyina ase all right enti omo ma dwumako o ma so ya sene world remit yes dwumako a je say but all this kako Ghana tetahwe oda ompom ba bia wo bia na obetimi de usika obetima send usika akọ Ghana ebe mobile money say you know amufra no wallet money system na wo Ghana ni nyina na obetimi transfers ayi ni obetimi usika akọ bank account bia and I feel class there the room kwa man ye den kwa na say there I'm support to school for yes back to school program ni nyina ekoso the more modern na mo form sika no mfa ho the more na mo dey fa ho no ana mamika we so say omo rate ni wosoro yes omo sika sem no rate ni wosoro pa anti mo ya ebetumi aba ama mo sika sem no nyina so aye dey akosoro bebrebe sa so na aye United African Organizations so omo so ya sene a edujuma die so bremo yes you go straight near shoot said by buy no one and I to me I so you did kakra from na yet me atwaso Dr. Cletus Baidoo mema watching ma wakwa about radio so
Yo ni akwa mejo so chief nyina so
na bibi aboko there
obo ade ada ma bibi aboko
Idanyamiasi. Me hese de was here and there was calm ya na just an information no obo yegu na person. Yes, there was a baby. I believe so the last time on your breast cancer was and now there were questions be and I can say you know at for the buy and I can say answer no the previous show no and when you so and last week the answer so and so am so and teacher say I'm questions in questions in ira enti no menem se bia oba take bia be 5 minutes na breast cancer no why educate en kakra said be ya omo the last time no bia no question be kwa bia overview no be ni pakro no a question answer na area na ya ba pancreatic cancer no so
me kai questions na ba last time
questions no dey me angasa kwa tell me church about and I'm into na ma me refi
I'm so the part na like because of time it rush you through kakra na I believe say a treatment hono
yes
yeah
I think so
into a treatment no yet mean can nyina cause Dawson the treatment na like I say for you discover so you diagnose obi so obi nya breast cancer treatment no baako say you be conserve nenufu no you see until you say breast conserving surgery and that's mastectomy into and nina and depending on tumor chrono ne kese any whether say I spread it akobe before and as in covid mastectomy into say you decide say a surgery dia any yetumi ko nanka baby a tumor no nko ana wo no you spare most of a new phone you spare nipple baby a tumor no yakutwa new for a friend lumpectomy into a lump into you are removing a lump it's a lumpectomy it me ba say you could train new phone in as so free or a mastectomy and depending on tumor no characteristics and say be spreading on it me say be you can determine say tumor no breast cancer na spread called lymph nodes. And I said joa won nipa motum no or na breast no tissue no drainage nefa. Into the was an lymph nodes ni na won say axillary dissection. And I only your surgical part no. And then so you chemotherapy, you use chemotherapy whereby a cancer is spread throughout the body. Just a surgery because when says cancer and spread a free be an enufu. I call like GI tract ne soon na asa ebisusu won liver untumi ko surgery e won nenufu na wo fura na call liver there be enye ne sa nti spread sa na hono na chemo no ye use chemo ye hormonal therapy so eno no ye hwe cancer ni so ban say hormones ben na o exhibit nti sa hormones ni try say be block no and you eno ni abefo kwan asisi aba you immunotherapy ni abefo kwan and so it me hwe cancer no the profile, genetic profile, manase molecular profile. Into do I say as cancer with these markers be into targeting markers with in rule. Nay say no say immunotherapy no any old radiation in the basically the fancy radiation mechanism the energy high beam fancy energy in a person they a blasted cancer and say the bear become cells. Until last time na no I'm say questions in the mankind say beside no yakobasa obi kaya obit masa ba
Mohammed Dan no high with no for se be ono obisa se me ma no for ate se dem kra no for no nyina pepepe benim se no
I think say no crowd
one sign okay. Okay, and it should straight to the pancreatic cancer. Now I mean obi as a pancreatic cancer no kra no any day.
Very good. Answer na yebe cause say the previous cancers na no. Me pato put me share my screen no.
Better swam.
Okay. Yeah, mommy enlarging na say.
Yes. Okay.
Every kind of yebeka briefly we ebia na OBTA for the first time anything na masadi we abana. Ye kasa cancer cry any day. Cancer nene cells about a body numa obey emra yakopon hye ma ni padua no because yakopon bibia o bia na orderly. In this part me arrow ni point no wo hwe ahye bibia perfect say bricks brick wall sa na nipa tissues na yahye no perfect in our foundation cells and no ye basal cells depending on tissue no ni asa ya bia ni amani di fufuro intino no say cancer cancer no higher blue na it doesn't obey any fancy rules and yet a haphazard arrangement compared to this normal party. Intine enyan spread enyan breaking through the foundation and basement membrane inside too. But we form picture we have a break it through foundation and air form. A do sana ni say invasive cancer. In America, Hanuman, where America and Ghana, and I say any part of the world, just US. You see, more than 1.8 million new cases in 2020. After 2020, you diagnosed 1.8 million. No. A more 606,529. You name so and that's what we in 2020. Make say 2021, but statistics like years, that's how it works. It is all breaking it down. Let us say in 2020, every day be an nipa best 1,616 and they woo with cancer in American Kwan. And you can't say cancer is the second most common cause of death in the US. In the American, I did nipa number one heart attack, any the keka and then number one. Uvi no free on my cancer in the Kuni Papa or America. Nti na na de no ye ka pancreatic cancer. Nti no cancers no na ya hyehyɛ no wɔ hanom in America no. Na pancreatic cancer for a man no of the top we say 10 of the top 10 no na in terms of new cases no na wo from pa. And for a man so no next to the bottom. Any leukemia no ya almost the same statistically, 3%. But efa owu we estimated new cases o. Into new cases ebeba bia no of the first 10 there e were from, but new cases in emu die dodo ekum nipa no rise eba number 4 for both a mema and a man. Into a pancreatic cancer is very deadly. There's a funny we now the trends are in America because cancers need be one to say we share lung cancer here na a shoot a cause or in terms of like nipa ekum where cancer deaths no. Pancreatic cancer and in terms of deaths over the years quite stable a cause crazy but not like massive increase, and it applies for both a man and woman. In 2020, Nipa said 57,600 in a diagnosed home with pancreatic cancer in America. So 57,600 in a mobile said 47,050 in a year with pancreatic cancer. And a meaning say about 82% of newly diagnosed cases will die of it. 93% of cases develop in the exocrine tissue. You better want to me show picture now because pancreas you break tissues into two major parts. You have the exocrine tissue and then make enzymes a chain like a pancreas and the or the peduano. And then they make fancy enzymes, I guess I know how making. Yeah, it is a woodidia, who fed you and who could not fool no cha. Answer Pana will be travel fool now digestive system now started activated when you who are condo and I activated now salivate now enzymes a digestive enzyme started secretive in preparation of the food now. If say ube ingest and also ube meneno alcohol body no. Into enzymes na digestive food no dey dodo na no pancreas na fancy a releases enzymes no. Now the part of the pancreas releases enzymes in a different exocrine tissue. Now exocrine tissue you can say exocrine tissue two major cell types, acinar cells and the ductal cells. Acinar nankasa pan produce enzymes ne secrete na ductal cells and only ductal like as a droben FM na akọ nsuno no. Make sure picture very soon. 93% of cases in A3, acinar and ductal is actually majority by far in ductal cells. And I say 7%, and only from endocrine tissue. You can say endocrine, pancreas and cells via and only produce hormones. The most common one will be insulin. Into diabetes, so being diabetes, you say be want to produce insulin, and that's produce insulin, so effective. And you must say pancreas na ye can answer. The pancreas na produces endocrine and so hormone producing hormones for lipidua. And ye hormones be a body in a pancreas, but specifically, and I say the major one is insulin. Now, we call the next one. See the incidence trends from 2007 to 2016. The incidence, the number of new cases of pancreatic cancer increased by 0.7% per year in white. Abrofo, into increase 1% per year in white. And 0.3% per year in blacks. Nti no wobɛka sɛ fencing ada na aborɔfo no na nya no mo anaasɛ ɔmunya no mo ana. It's I believe say the major reason is screening, because when one detect here, statistical information and inform reportage. Now abrofo no in general, you can see medicine in the US, there's racial bias in it. Abrofo no they are screened at a higher rate than tutumfo. Into obviously we detecting more than tutumfo. Then there was mortality trends. There was between 2008 and 2017, death rate increased slightly 0.4% in whites and decreased slightly 0.5 tutumfo there. Death rate follows slightly, and the exact reason I couldn't get to the bottom of it, but just looking at the data and what the way I'm interpreting it here, said the entire death rate in blacks slightly decreases slightly. Say you dear, I can't say. You detect diagnosing in blacks and the treatment the more tutumfo good. Basically statistical data numbers in play games it just see detected tutum dia be treating kama, but you time detecting tutumfo because say in screening case here statistics incidence rate in tutumfo no form because say you detected, but you detected there and only you treat kama into na death rate seems say I call from for abrofo no say death rate is slightly increased because when in again statistics you have to find the end the total number of cases in there. But me I'm won't say information in very valid and I say valid, but as it is, and that's what is reported in the data. And me can say me can't normal pancreas and who asem. So usha picture here we idea da brown kakrakai nipa brebo no liver nini esopa na and we so no nipa nsuno the early part of the small intestine and if any duodenum duodenum ni and we bonyo no gallbladder na gallbladder no fencing men can say droben connected gallbladder na ebefa yellow ni pancreas ebefa pancreas mu emma ekopie ewo duodenum hanom opening if an ampulla of vata na pancreas na nkasa no ono so wo droben tintintina emu tintintina nti say we share that picture the next picture we are I think say no yi bonyono na part na efri mu die but we say pancreas na da hanom say yellowish no na we say droben tintintina na say duct and a tube ewo pancreas ni fin and if a pancreatic main duct nti no ni ena the fancy bonyono so no tube no any if any bile duct ni mie no ebekesi na ebekesi na afi de abe a tube na be baako nti ena is common bile duct na enu nkopie ewo tokro bi da fancy duodenum no if an ampulla of vata it is so dia wodi aduane no na yefunu no na try say be breaking it down no it drew this part of the duodenum na enzymes digestive enzymes a secrete into the duodenum na aboa with digestion. We can say exocrine pancreas your two major cell types acinar cells eno ni na ye painting or yellow ya me de me arrow ni follow no ena ye wo ducts no and as a ductule say a branch and is a ductules and those two no they are embedded in a connective tissue. And apart from that, yes, I were a pancreas, me pancreatic islets. Islets, and then endocrine pancreas, and then produce insulin. Or she said, well, islets, so pancreas, islets, and also those cells, as in clusters, in groups. So islets, in fact, are same kind. Ni nyinaa kɔ burning out a onpa kɔ no automatically ntumi produce insulin when you are diabetic. And that picture we show about pancreatic cancer and only an topic no. Now pancreas is divided into different parts. This part I bend duodenum, we need duodenum, I bend this duodenum, and a friend of pancreatic head. Into that's a nitinie. Into say nitinie dia any any tail ni na a free ni tail hanon echo nitinie say on any pancreatic body. And the junction between nitine and any body no so you see pancreatic neck. Just an arbitrary designations a bois doctors you delocalize maybe a tumor no for communication purposes. So here a short picture here. And no tumor no are formed in the pancreatic head, and most of the exocrine tumors no. Hormone in a tie happen pancreatic head no in a tie form. Now pancreatic head no say earlier picture me show you no. So say anti-honey head no. Head na tubes nam hanmo. Your bile duct in nam hanmo. And I say pancreatic male duct and nam. It's a tumor no form or hanma. It me block a side tubes when my a draining and I say a security enzymes they are called duodenum to me block no it say bile gallbladder and liquidness is stored on the bile no blocking na ni bo se ni pa no na the skin na attain yellow yes why jaundiced. I mean this picture we soon show say tumor be so air form but when in a location here like towards the pancreatic tail onto the pancreatic tail. Now endocrine pancreas no endocrine cells no they can say a pancreatic islets no and is the major example no and also so no a form tumor and a type of pancreatic tail hormone. Now those tumors ni a kabum because there are different types of hormones, but yakabomu efro omunina neuroendocrine tumors. Picture way obia wonya pancreatic cancer na spread yakone brebu. Can normally nka brebu no sha reddish brown on liver no a reddish brown. All these white patches a tumor. Into when you say I advanced a case. Now again,
Doctor, I'm son of a risk factors in the son. What more coach a crama mea now cancer, secretion no on a faha and a faha. Now, secretion no again a bois I want to produce because a cordial denominum. Again a bois want to produce.
Yeah, instead, make I say a secretions no. And only a digestive enzymes. It by the name no crown no dear Juma ekodi.
A cobwa digestion.
Yeah. Say fancy woody dear, you need these enzymes to help break down the food. You know, say the body bit me absorb. When you know what do it may call when I'm not quite more aqua Juma. Now a fire be a healing crana. Aboa amwe hili aboa ma wenyini just basically keep you alive. And these exocrine and enzymes the function for digestion. The function, And I can say you are a endocrine. Endocrine, there are different types of cells. You're listening to one. It's a beta cells, and they produce insulin. Your alpha cell produce glucagon. Your delta cells and will produce stomatostatin. When we know hormones are a buan lipidriano, but the major one panana a hormones a panan and make I say the major one most people in insulin then I produce produced by the beta cells now. And but the pancreatic cancer no we want some kakri because any as common as exocrine pancreas no in say muda ho
Muda ho
answer American one say I mean say Steve Jobs you know him say pancreatic cancer ne kun the type of pancreatic cancer Steve Jobs ekunu na endocrine pancreas into free endocrine tissues no mu eno na fancy mind say you try say but because endocrine no ni nyina na ye kapom efre no neuroendocrine tumors into Steve Jobs onya neuroendocrine tumor eno ne kunu so wo hwe root if it's a Beta Ginsburg, I think said that was her name. RBG, US Supreme Court, US Supreme Court Justice who last year man Donald Trump in opportunity started you can say radical because she Supreme Court one.
That's I don't know, go politics.
Practical. Yeah, only saying that woman is saying meaning say and no ne kun dia but ono onya different types of cancers pain onya now that I'm talking me sure say a doctor but yeah the most common type of pancreatic cancer and a ductal adenocarcinoma no ye fall under exocrine. It may sound confusing and so that here for TF1 so the differences per se. But it's I think say what is more relevant say enema ben na risk factors enema ben na increase your chances say you benya pancreatic cancer
And no pan here because so you say you be educated say the be I did go on more you betimi be a lifestyle changes bo my betimi aboyan ama ya we bebrebe no you betimi aso ano no so that is pretty much the basis of this show and we can pepe
yeah and you can say risk factors be na as I see in previous programs you can say in general you divide it into two dear ubetuma ye hu bibi any dear untumi nya hu bibi because risk factors be one ma ye dey awo genetically nipa su untumi nya hu bibi risk factors be one ma based on gender or sex no so ye wo bema genetically no ye bema even kran so kwa ko ubi sebi abadam sema e koso wi ase no kodi echi kran so afi de menye bema bi omi oba wakoye can say surgery ni sa de keka hu ni na genetically no ye bema intino risk factors still and say high for bema we affected but then no ntumi nya ho hwe because it's part of your constitution the way ankopon esibol eka Inti eno ne risk factors a untumi nya ho bibi. In your risk factors a betuma ye ho bibi. Risk factor number 1 a betuma ye ho bibi cigarette no. So onum cigarette o chances of benya pancreatic cancer no 2 times a normal person or onum cigarette da. Medical can several times say one of the worst things a nipedua no ubetumi aye unipedua And also say one of the events a wickedest way of some designing to destroy the human body is cigarette smoking. There's no benefit to the body, zero. And then there is like a whole book list of like problems are leading to. It is so smoky. We one can smoky, but we in an environment yes, you are exposed to second-hand smoker. Page for because it's not worth it. I could be an on my worth a second-hand smoke. Into fencing a major risk factor for pancreatic cancer. Now, and yes, it's a see, I don't know. Almost say you was smokeless tobacco. And he increase your risk for pancreatic cancer.
Sa vaping on.
Vaping, a minimum difference, because those things in the name instead of any other vaping in a be a chewing a fencing a tobacco. Would you also won't try them to, but who would chew? No. And so be you are exposing yourself to getting a esophageal cancer. Because that tobacco plant, nyame am say ye man smoke your lungs man your body more. But nipa there. Another risk factor is type 2 diabetes. Obi or diabetes no. You need the exact reason, but just by following the data no. We need so obi or type 2 diabetes or you're at risk for developing pancreatic cancer. Excess body weight. Go back to type 2 no. Type 2 no. Or lifestyle will lead bet my money type 2. No a BB risk factor be with my BB. And they are all interconnected. Usha weight so would D ye. It's all connected. Into type 2 say like obi deep man bro so gluttony. When someone may pa say the best say the obedi higher. You get a type 2 because what happens is say the more would no like all rest of stomach no so good for you. Would activate a machinery in your body to break down the food, to digest it, absorb it into just say what turning your digestive system no. So far say machine what turning on say juma. The more I will turning on so cells now we can say friend endocrine cells are bako type of beta cells are of Langerhans, islets of Langerhans, I produce insulin. The more we turning on, that cells are very fragile. And yes, cell like one more thing. The more we turning on with gluttony, with the bro so crown and I will see one would need you are burning those cells out. Until that's the who were keep cells in an upside back the cells die and then they stop. You don't have like they are not producing enough insulin for you. After they know yes when you're why diabetic. Excess body weight and you're good. And until but my own baby lose weight. Should do any DME share when I would share how much I would do. Any napa exercise so come. Factors you are utmi yahoshe or family history busia ya wutum. Utmi yahoshe because senka utmi yahoshe anki yemu binu nebi anka Bill Gates munu nanki ya wuye too. Yeah, utmi yahoshe in family history obi one ma na nina pancreatic cancer. Nina pancreatic cancer. Ni papa so nya bi. Enti ono sa no na hon ma enye obi na we say control ni sebe or ye high risk nti kika so on so benya bi. personal history of chronic pancreatitis. One of the major cause of chronic pancreatitis a stone on a block duct, because in nature and say a flow biana the natural cause if I say river river it was a flows and I say streams a flow creeks a flow and a bumana be a river needs to flow and a sea. When things are flowing na in nature and also in the body the chances of infection and I say inflammation in the form. Idea was a flu no block na the results in inflammation and stones make stones and your kidney stone and make gallbladder a bonyo nankasa no a mobile be a fencing ebemu and I say a form of calcifications a form of stones I find gallbladder stones and I say calculus. No, if you want to say, a cassia, if you want a cassia, a bit me, if you want a cassia, best a cocomuti. A Susan, dear, and to flow down through Droben. I mean, go back and never go on my this is the picture. Try until when gallbladder no. But you screen.
Yeah, you want to come up.
Until gallbladder no way no, and that's a bone no. A mobile bit me for more inside. You find gallstones. Now gallstones say a yankitin say a cassia party, I would have 2 way cassia. A kit way be into say stone and cacracabe say a bed and a flow through way and no inflow. But the bone man form kitty tiny gallstones and then they cause problems because they flow down a bahanwa, it may flow down, till I be a better okay here. I'm also saying about down one about the choky hand, and I say at this junction not choky, and I say if you can an ampulla of weight and opening to the duodenum, now a bit choky. A bit choky sana preventing the flow of secretions, digestive enzymes and bile. When I make the can say block the normal flow of a BB in the body now, the results are unyan and inflammation. It's not a cause of inflammation. Inflammation, say acute pancreatitis. Say a cause for chronic is chronic pancreatitis. Now, chronic pancreatitis, 70% acute mostly like stones. But chronic pancreatitis, in there, 70% of chronic pancreatitis are linked to alcohol abuse. Onomunsa and sansoso one idea it is a cigarette nankasana nipediane ni hia alcohol bia e wo body no ohia alcohol like you said you concentrate fencing alcohol ni enum gumu poison we introduce it to your body. You are increasing your chances of getting chronic pancreatitis, which is a risk factor for pancreatic cancer. Heavy alcohol consumption is a risk factor. Yeah. And another risk factor, genetics, BB Lynch syndrome, and then a genetic mutation increase the risk for colon cancer massively, or develop polyps, or in like pre-cancer, or in China and soon and no be a colon cancer. And near colon cancer and Lynch syndrome linked to endometrial cancer crisis linked to it. And a genetic I don't know they are won't mean your last time I can a breast cancer was a some mutations in BRCA1 and 2, a transfer cancer BRCA1 and 2. And also so do was some mutation in Bia and on fencing your risk of developing pancreatic cancer and it's in the cost because there's a linkage between these mutations and pancreatic cancer. Now, no, again, no, when I'm these mutations, no, BRCA1 and 2, this will be a show family history, not be a breast cancer. If you say, family history, breast cancer womb, a man be cramped in your breast cancer or family. And age of linear, so I know time young, until you who sanana as an antenna and raise, you say, okay, yeah, say genetics being a outplay here, near Paco Tessie, near Tessies, or more BRCA1 mutation or BRCA2 mutation, and into breast cancer or family. There are other genetic factors, but in general, no, genetic factors, no, for most cancers, and also to say a lifestyle, lifestyle, so what person be
answer symptoms no. Questions be about.
Okay.
But I address our questions and sana we are commercial break now ya babe symptoms, signs and symptoms.
Very good.
I Eduardo Fori no business that's having sickle cells disease pose a risk for pancreatic cancer.
That's having me off the top of my head here, can I say sickle cell or the cancer sickle cell a type block blood vessels and into now a course like I don't know the rationale behind say sickle cell the rationale behind a question. Off the top of my head here, I don't see any linkage because sickle cell Adiana block no blood vessels and yet ducts no. Ducts no na you say a bibi ko block stone ko block na leading to be a chronic pancreatitis. Now I increase the risk for getting pancreatic cancer. But off the top of my head here, any linkage between sickle cell disease and pancreatic cancer. But me look up now I'm a chief.
All right. Salima and so Salima Pukia. Also, I have a sickle cell friend whose gallbladder has been removed due to surgery. Therefore, her eyes is always yellow. No business why.
Oh, okay. Salima, o question is very, very brilliant.
Manefa we can also in because so also fatty male like a fat woman baby.
So kind of brown. Yeah, Salima, a question now will be a very good question. What down for sickle cell and you removing the gallbladder no. What's still an eyes yellow, ne dientina, ne eyes near yellow no. Obi or sickle cell be or high turnover of red blood cells no. Because the red blood cells no. Ni shape I was enka na coupon design is also a normal. I sickle. If I say yes, and the reason say a sickle the cause problem say normally the shape and coupon design and red blood cells a pliable would be bending until say a blood vessel get crown with my bend to see a film. But more than an sickle I have more rigid. A qua say be a tokru be saying I was thinking a pass it through. Now I rigid into mean pass it through. Now I call block a quine. Now other ones and so about the sickle cells are about compiling a block. Now or after the munya sickle crisis. Now nam the shape in intina abnormal in body in soon a fancy a break it down sickle cells in 10. Sickle cells and last as long as normal red blood cells are it bear 120 days. Until they have a high turnover. High turnover no means say first red blood cells they break it down be release hemoglobin no. Now hemoglobin I can't say the breakdown of hemoglobin and then the causes are yellow rain no. Of the ice na womb no. And no wadam for no dey no. And chema me dey amount say ne sickle cell no eno ntina fencing and I'm so high turnover of red blood cells no eno ntina ne na yellow no gallbladder na ye remove no from madam for no it means say in terms of like developing gallbladder stones in getting a pass it down na be call so chronic pancreatitis the or a lower risk because the gallbladder na nankasa ne fencing any hono nti mu kakra me de be ma wo we
Yeah, my main follow up. I think Dr. Koku say also didn't know the about also directly. I don't think sickle cell causes cancer, but sickle cell patients are at risk of gallstones, which can lead to pancreatitis. So they're not which
yeah, that is true, and that's why fencing sickle cell patients do on mount I can say bile duct blockage, obstruction. Tina feeding a cholecystectomy, I could remove gallbladder. Yeah, that part is true.
And
but intrinsically in it, yeah.
Yeah, I know. Side by you say a chronic pancreatitis has an increased rate for pancreatic cancer.
Yeah.
Outside at the buy no.
Doctor saying the buy
yes.
And doctor say no correct. You can want some to see about a chronic pancreatitis, and apart from that, you can say a major risk factor for getting chronic pancreatitis. Next, a very increased risk for pancreatic cancer.
Yeah, I do the first, excellent explanation, Dr. Ato. Just watch it to me, I'm an super. And instead of the kind, we go for commercial break. I'll just say, check a crack. And yanko commercial break. Now, your coba, now your baby to also with the signs and symptoms. Dr. Ato, mom's been with you and the pension benum. Let's me pension piano. Now your bar, now your baby to also.
Me that.
Just one more pic, JJ, please.
Oh, Mama. Really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services, as a foreign transmittal agency by the Massachusetts Division of Banks, number FT 1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT 1179663.
World Remit, a better way to send money.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65. Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS, IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, yes, I am about Akko Radio. So I health and wellness. Yes, so good show with you. So I do a feeding out to her. Yes, ekwe nim kakra ne pancreatic cancer wansam na yɛkan na Dr. Atwa chechiri mu ye pa o ma overview no wo de ewuram ekwan fa so eba ne the risk factors ni gyina no wo de amai se ne yɛbɛkɔ signs and symptoms ne so na afei yɛtumi de ade aka gyina so ato na me kai wo se dwumadi ɛyɛ world remit obuna aso yasene ayede we nyina ebrem na so person so ni sika ko Ghana enhwe ba bia as world remit omu rate no form sans so na ba bia person this kind of bia no betimi dia fa bank account mobile money mobile wallet your pen bia no omu ba Ghana nko wiasem ha nyina ba bia person this sika ko bia no omu betimi dia ayede akwamo sans so na union another African organization for so aso yasene so person register with obaso ko nwomo a omu Facebook page information on bibia wo na so watimi akọ contact o na bibia akoso yensan ento aso na ye to aso de ne ye de signs and symptoms of pancreatic cancer no na eba enti Dr. Ato why ready to aso my
Yo chief for damasbium yeah. The signs and symptoms of pancreatic cancer usually no signs and symptoms be until say be a disease cancer na advance usually no yeah they are diagnosed be one man incidental be one man be bintina or imaging study be na you but say but BB dead yeah
Dr. Ato so and then obetuma kire mu de ntia yes etisa just wunya uhunu is be a tell wo kan no I just wunya ayekese ansa na be yet me diagnose agent na man basa.
Okay, that's a very good question. You were certain organs be on ma so binya cancer be on ma and one here in term intrinsically no, like ovary say one of those organs, pancreas another. And pancreas another reason maybe a in term me show up picture we say I want to make I said there's a duct and a drobent into be a sunny pancreas no pancreatic main duct. And I wore a fencing bile duct na free bonyono no and a be connected is a common bile duct na a p. Say cancer and a develop in this area are air block secretions here. Into location, the may pattern say location first say one of the major reasons are a symptoms and also symptoms. It is a block or animal cause so obstruction there and no bit mania open pacono no obit say not be a jaundice. And idea cause a jaundice no make I say a breakdown of red blood cells no but product na nkasa no e break it down na bilirubin no it mean ma o skin crown no e wo hene so obi won ma na bia o hwe na because I'm a medical student years ago my crisis here I say Papa hospital the reason or the bar hospital say I say and I admitting and the reason they admitting or the bar year me eventually admitting I say nearing who said over the past 1 week near all of a sudden any eye yellow in the white part no
yeah
I yellow and
that's why I jaundice
yeah say jaundice yeah and no you can share image in nature say when you obstruction of the common bile duct because not cancer form air block when say secretion of bile into the duodenum no into into location question location in Ebiana akoto baby and block any of the block pancreatic main duct and block bile duct no ebiana akoto tail animal everything na say like you be asymptomatic for the most part no let me go back location no Yeah, location and determine like say be a fancy with many symptoms and I say unya symptoms be but I never be so on my with me who say weight loss. Yeah, kind of under this program, cancer programs are a series say who lose weight anya intentional won share da anya wadwene say pia wo chiru yam kom and I say wo change wo didie like any intentional who did regularly but now we lose weight. You have to go and get it checked up because it can be a sign of say cancer be in a developed war or body no more. And abdominal discomfort obi one man said ni yefunu no and I know this is very common there ni yefunu I say ni yefunu ye Ghana for be say one kind be some styles be on me and shedan ye pain say bia oh ye ni ya bia but like discomfort bia it's hard maybe na irradiate I say ko ni chizu kakra and also it me sign say bia na pancreatic cancer. It doesn't mean say obi nya sa ni yefunu ye no phone like weird bisa na just say pancreatic cancer but I am per se ye be kan ya bo amanfo ehu unnecessarily but
so that can yen Ghana for no the unya kasa we who symptoms we na we ya and the tikra na ya no aka just say
unya cancer
the continue work already say to tie ya da anya wanya cancer.
Yeah,
so that we tell mu na good pa and listen go and have a check.
Exactly. The whole point of signs and symptoms, you say, oh, in fact, will be unintentional weight loss. Say, oh, hormone, a big part would be more class, lose weight. There can their party say, corner a doctor and coffee shade the interior. Catch a doctor, no shade the interior. It could be say, be an affair, the wabe, unim, cranus, say, oh, you're diabetic. Because it will be a diabetes, insulin resistant, no, or to me, the deeper, but on your can see it. And I said, people no lose weight. Another signs and symptoms, you say, all of a sudden, like now be a diabetic, type 2 diabetes. It can be a sign and symptoms, say, and can fit it in and like diabetes, instead of running in your family. And you've been fine, and now suddenly you say, oh, you're diabetic. And then so it can be a sign, say, be a tumor, be a ecoso, body. Jaundice, you can't want some. Jaundice, say, be a block a bile duct, and I say a common bile duct now. Tumor, no, not block into the secretions, and I say fluid, it means go down to your duodenum. Now back it up. Na bilirubin levels na SU2 up. Na mouse skin na aye yellow. Inti also say one. Severe abdominal pain. And then there do severe area more there. Nature say be na advanced. Another so you say nausea and vomiting. It is all symptoms when we na and yes BBB like or kind of specific. So we are na nausea and vomiting, near my baby, bet my manipa like obuafun around my waffy. But in general, no. So we started say we feel like new GI symptoms are. Say be a fed we will be now buffoon, but I fed like I said buffoon, maybe you feel bloated cry. And I say, we phone you on the phone B. I say, yeah, one kind B. Go and get it checked out. It does not mean say when you're cancer. I'm saying that again. So it doesn't mean say when you're cancer, but it means say go and get it checked out. You ain't the cry,
Yeah, the doctor now can weight loss from one. Obviously, but say, can someone have cancer without losing weight?
Oh, yeah. Cancer without losing weight, especially when we're going to begin with crying, not or you're very obese. Also, you're not say and now so that lose weight, it show more than obi also.
Yeah.
Obi also no one here fence who say ono akra no one who say we lose weight here. It wait when your cancer abra won lose weight. But say advance here, most likely say we lose weight.
Okay. And yeah, transform.
Yeah. Okay.
So diagnosis no.
And your quite ben soon ye the first oh, I should have edited this in a transrectal. Ultrasound. About 1 second. It just a typo. Yeah. And you know, one way I make it diagnosis and say yeah, for ultrasound. Near there a share nipa no ne so no ne miyem ho no. They make sure say bibi fufuro bi anu ma grow new growth bi anu ma e koso ho no. Yetumi another imaging study to say MRI. And also no etumi bua fence a diagnosis. And also say bi won mana GI doctor no. Ukoma o symptoms say o yefun ye on the phone who feel bloated like it be a pain kakra bi so fra nti eno no to be ko ye a study bi a USFNA endoscopic ultrasound guided fine needle aspiration na eno no me chase kakra and it me another study be we no crowding the more like say a staging bone scan and a PET scan you say who be you say unpakonya cancer you say how advanced aye near your scan into an ultrasound no and then the radiologist following the read me a radiologist into no or man kasa no mu read a ultrasound now or share ne omofre bibi echogenicity senior like ultrasound basically a sound it's a sound waves on different ultrasound into a or the probe ne fa nipa na se ne yema na say a pancreas area monoma a meti sound na a can sound in hit tissue na sa I can say I reflected back probe na the ordinary yefun na ewo another part a detected fancy sound waves na reflected back and no na computer algorithms they are generating imaging and by imaging after don't who say ebia tumor bi form ewo ha na se ha and no na one way make MRI no so no omtumi yedi detect say bia pancreas no bibi ekoso ewu mu ana nti we pancreatic head nti radiologists no they are trained and you know eyes ne enye irregular eyes no we try pick say aha no no tumor bi fence form ewo aha no na say afidi na ya hwese bit my biopsy na your PET scan there. Every tumor I shouldn't say every, but most tumors and cancers are highly metabolic, like a use energy. In study we a peke baby a fancy metabolism high in social will be where a fancy coronal section of the body in the lungs ni akoma ni liver ni stomach ni in a pancreas na hanan asogon in a very hyper metabolic into hanan pancreatic head na asogon to say a BB air course or hormone a most likely say a tumor into say a imaging ultrasound no another MRI maybe poor CT scan a detect say a tumor bi wo ho no na GI doctor no or the tube bi afa nipa no or the afa nanum or they go through the esophagus na go through the stomach no na or the aba baby a pancreas no pancreatic head na start enti no sa tube na offense or use no tube no na no ultrasound so a probe ni bi wona no say one computers in chain no or share image no na amana hu say we drew baby a tumor no wa na tube na no so no the device bi on ano a etumi a needle etumi manage a pinch and I say can say odi poku echo tumor no mu na ko take a sample bi one aspirate like or chain say a nsuo no into a chair no the pathology and no say a fine needle aspirate na ya hwe say a cancer bi e wo mu na say enye cancer and in actual fact no especially pancreatic ductal carcinoma no to me the easiest way to make a diagnosis is aspirate some change so to make cells be out it's the easiest way because pancreatic cancer diagnosis they can't like histology and as a pathology it can be very challenging sometimes so here chronic pancreatitis or microscope as here now they share cancer now I want here because it's especially say cancer na well differentiated like cancer onyan soro bibria into we a picture we a histologic section now think I'm this cytology so picture a tomb but anyway we a histologic section of pancreas yes as I said we can use our words we exocrine pancreas endocrine pancreas exocrine pancreas and then by far the majority of tissue or pancreas no and then can say if the major the two branches near axina and then they produce digestive enzymes and they walk or continue to axina cells and they pancreatic ducts and the ducts in the but most pancreatic exocrine pancreatic cancers in any ducts no we need getting on and on axina cell carcinoma very common but pancreatic duct carcinoma common last Friday crown the diagnosis obi but on crown they interesting obi pancreas na a tumor about the pancreas to almost train cells me share who say okay cancer until you also find out a cancer brain you go here and they say no or lung cancer and that's when your lung cancer pain in a spread na about the pancreas into pancreatic primary if you be metastasis in about the pancreas but anyway into exocrine pancreas do na a pancreatic ducts into pancreatic ductal adenocarcinoma and in the by far majority your endocrine pancreas a cancer islets pancreatic islets different types of cells in a womb the most popular one and a beta cell na produce insulin but so being a cancer a pancreatic islets ye brain hum ko fefi mum kaka a beta cell and I say a alpha cell because the treatment is inconsequential for the most part inconsequential until you group under one umbrella kaka when you pancreatic neuroendocrine tumor now as I said me can say nubina Steve Jobs in ya the thing about that pancreatic neuroendocrine tumor is say the behavior no very hard to predict what when your pancreatic neuroendocrine tumor be it may look say cells look bland maybe your study be a KI67 and a shred how our cancer is grew like it's a way be a person they predicting how our cancer is grew like a proliferating. Okay, in the KI67 study now we are be low and so now that person on a pancreatic neuroendocrine tumor now spread it all over the body. Obi so on head a KI67 na a high insulin the pancreas more like an indolent cause. It's very very hard. Say you better predict it accurately. Say endocrine cancer nipa when you want a pancreas ni behavior na be aggressive and I say any aggressive. Very hard. I mean, okay, okay, image way the most common type now I can say ductal, no, the pancreatic ductal adenocarcinoma. There's no disorder. You can several times say I did the first thing that cancer under microscope. The first thing that strike you say haphazard growth pattern. There's no order. No plan. Yes, I am a body. I am a body and be out of channel. Come. It is also say image we now couch. Now the crochet normal way now. Say a fancy black and white. It the same. Into winning a cancer, we higher magnification there. Cancer, it may a bone scan. On near per se, I say, I didn't spread a person here. Into winning this image, necessarily will be a pancreatic cancer, but we a bone scan now. Maybe a fancy cancer, no, a shabby and I tun. I want to say image we need pack away. I think it's not only breast cancer there, but Osha, there's a cook the ribs, no. The spine in our womb, it does a breast and as a prostate, probably prostate. A fence and a hip bone, the thigh bone, a fence and the jaw bone, so you know, and no cancer and ADD after.
That's what they know. No.
Yeah, unfortunately, and I say, one the prognosis in any good. Yeah. Into the medical treatment, and so I answer question.
Yes, yanko treatment, no, so na because as a time, no, you make up time, kakra, yeah.
Into the treatment, no, surgery, one way I treat radiation therapy, the high energy beams, per se a tumor, no, in layman's time, make us say, no one and I fry, no, up, and radiation therapy. Chemotherapy in layman's term, I can say like a drug and a drug a poison, but you need say cancer cells and a highly metabolic. Here more energy, here more and road to grow to keep on growing crazy. Poison no more decay. Any chemotherapy. I say these may extend. It may extend survival or relieve symptoms, but seldom produce a cure. Less than 20% of patients are candidates for surgery because of metastasis at the time of diagnosis. 80% of the time, not a pancreatic cancer, not a and it's because of again, make I say. Tissue be on money location and then an intrinsic properties very hard to like pick near early. And I mean my example say ovarian cancer say in some pepper ovarian cancer so in the way in a ovarian cancer most of the time you say for surgical candidates no or and that's will be a surgery with my no. Adjuvant treatment, yes, with surgery, man chemo, and the OSN it means one a risk for recurrence, but for advanced disease, chemotherapy, and sometimes with targeted drug therapy. So see, I don't know your advanced medicine, immunotherapy. Into your show, nipa tumor on it. Pathology for no say tumor we properties ben or suban ben or what I bit may use a day a targeting needy to us here. For a maybe crude example here say be a tumor way dear as some count tumor way dear be or pay jollof. Into say okay, so I a made jollof be soon if you I'm try say a person with benya or no tumor no me kuna. Sana targeted therapy na ye You share a fancy tumor, I share the genetic profile. If you want my was certain markers be a one near use no the drug targeted some marker near the patient. Yes, it may lengthen a survivor. Surgery, no, a major surgery for pancreatic cancer. Major surgery. Your friend of people say, and it depends on locations. Say, well, pancreatic head now, and I say, be a neck, no, na body no close to this part now. Surgeon may design to be a ripple procedure. Ripple no the oil and say, or fire you no distal portion of the no or the second will be trying to say through. Not offensing would trap a part of the pancreas, so would chat way into this is pancreatic portion a good new and a tumor no. No aside the second answer could chat and soon on the other end no would the chat into that. Baby, ya highlighting the pale no way you when if you on until we are not a bile ducts no or I can know that cause salt and soon a portion of the insuno or the stomach and I could touch it or suture the attach it or the pancreas and the distal portion of the pancreas I can suture to the attach and if any ripple procedure. Big surgery, major surgery.
Now, doctor, I don't know how do you get the head back because it looks as if the head in the freeway.
No, what type of head and we'll tell you can get through one. On a problem, no one if you don't want it back. Because a cells never head and one what the rest of of the pancreas now can. You don't necessarily need the head, no. And the head, the everyone is an anchor ducts and but umucha sana ye chat ducts and so afra. Intina fede na wa re-anastomosu wa reconnected bile duct to a portion of the duodenum. Wa reconnected stomach to a portion of the duodenum.
So the city power Dango Point, no. Now, I say you really carry na abe as a pow.
As a sound rough, yeah, but a boy so it me prolong go be more life, you know.
And I'm so your treatment be on more. Yeah, and a bit me a cure. I pass a pancreatic cancer no cry. A bit me a cure.
And I won't say me can say or say these may extend survival or relieve symptoms, but seldom produce a cure.
Yeah.
Occasionally,
this, I mean, who this and say there was no and answer the aka form.
Yeah, there was no. There was surgery, radiation therapy anytime.
Okay.
Obi on man na bia very very early stage small tumor. I think say RBJ as we call justice in the pancreatic cancer. Some aminonia cancer be brain tia man kind time.
Yeah. I believe so on bet 3-4 times.
Different types of cancer.
Yeah.
Until on say no, I believe the pancreatic cancer ye who in term. Until omu ye na be onya be 3 years cancer or something like that. Yeah, until ebi so on mana tumor no say the medical kind and ebi on mana enye head na ekoto tail no until no say na surgery mo ye fan distal pancreatectomy until on no umko chat a tail no any spleen no ucha tail na spleen no essentially any ka ho na omotwe free ho no na fan say the end of the pancreas no until where a piece of pancreas aka no residual pancreas no ma make sure say bleed until na ya shut and no up until we no
spleen won here bi
oh nipa you can do away with your spleen don't say omo here Dr. Ofo requesting obisa sickle cell for you say the disease na nkasa no kra no it me excess spleen no because spleen in sequester maybe some too much, but a disease let me say spleen into obi or sickle cell patient no say the spleen are infected or until basically a need to have a beer. you don't need the spleen to survive. It's essential. Yeah, until the way you say no, until this surgery way compare a head of pancreas a surgery. Now, what me say, when a major dear, but it's not as big. The other one because when in soon no I mean, your phone no still no in China, your phone no the bile bonyono no bile duct no still and you just say in a CT na is there a portion of the pancreas no the body of the pancreas any spleen in a yetra efrim. It's not as major a surgery as a repo procedure. Survival for all stages combined, almost 5 years survival, 9%. You say over nipa mu pancreatic cancer no over 10. Now say about the next 5 years na bakope na aka 9 and even for small percentage of people diagnosed with local disease, which is about 10%, 5 years survival is only 37%. And pancreatic cancer is very deadly. So if you call for survival, there's an no. Swati time you can say a lot time at that so the survival majority are diagnosed at advanced stage, about 53%, with a 5 year survival of less than 3% of about 3%. Yeah, and majority of 53% of who advanced a pancreatic cancer. So me any 100 yes, no 97
Wow.
And prevention it's hard to prevent pancreatic cancer, but the obit my say lifestyle changes there who bet my no or so ye. So idea a common theme in cancer presentation say ipeduano no uhweso year eboa wankasa udidi year eboa wankasa one first cigarette and county pedria eboa wankasa one non sa eboa wankasa edidi ye no enye fufuo tele ne nsan ma ne ka wasem say fruits nuts vegetables o man no a bigger portion of your exercise or maintaining a healthy weight in an important point in so you say routine medical checkup and chain na ufli CPB no phone of one ade ba kwa brofo ya ade and doctor say wo oda so obedi mu adanse say ade ba kwa brofo ya ho ade say obruni say ne ho ye ne nwen quick no they call hospital and I would call clinic or catching doctor yes so dey bu on my own enye she ni ebu ye ni eguso ntine by the time ni ma ho na say I advance na agency yeah ahana me be see but we do a question and say the next part
yeah musa questions for maybe about the next 5-6 minutes be na wrap the show up because Mohammed to abetom na say Mohammed so the oba ne sem no doso so pa already Mohammed say wunya time no bebrebe Dr. Atujenia Bossman George Bossman or YouTube. Now the question will be answer can stress cause pancreatic cancer?
Not necessarily like pancreatic cancer, but yeah, you can before say stress will and you're good for the because on a daily and I say on a regular basis, you see any cancer crying, and you diagnose you with cancer crying. You have mutations happening in your body all the time. A lot of them, happen your immune system just a fight you, fight cancer so. Your immune system regular when in now your immune system will keep protective from cancer and your DNA other things. We have a healthy immune system. ɛboa prevent a decrease or risk of cancer. So we are stressed who produce a fencing hormones cortisol high no a suppress immune system no. Into your immune system don't work as well as say obi a ono more relaxed obi a oye. And me cancer we on say there was a study be about like religion or Christopher. I think it was mostly about the say be any religion and like Christopher very people of faith no. Now more chances of like immune system is stronger than obi a depressed. Into no say they protecting from cancer and so many things. And as a rule of thumb, anything behind good for no, it can worsen your chances for cancer. It may not necessarily be pancreatic cancer, but all forms of cancer.
Okay, yenya boss man is in no no. Also stress enye mani padua no. Na ade enye mani padua so dey betimi akose a whole lot of other diseases. Nti no na nchiremu no no. Yeah, so that we can I just say sports for no must have been me console but the time no nyanso nti mfi wo mokra. To Dr. Ato but me so we ana ne ba bebrebe sa pancreatic cancer no. So obinya so na wo kan no. The so why you need a rate no form or form pa zebia because o ka say 53%, you know, almost our rate, you know, for 5 years, you know, it's about 3%.
Yeah.
I mean, just now a beku pa. Now, young share before any abrofona and we started now oka. And no, now oka be before no, the way ni be and Quebec so much chances no form kakra. So mobile be no form kakra chan abrofono. Now change him. No, say na definitive there. But the people sending in an answer, yeah, to because you want more a chain part of more into way no sunny city compared to our brophone.
In general, cancers no. Yeah, no. Some I can program super no. As a culture no as a no. You're very particular about your health, and only a one. Like the reason part of it in your young casana be your culture and I say your behavior in general. You be any good near so easily compared to like abroad. Because sometimes they do one of my biopsy be and I say be complaint be or the doctor and maybe who I'm say like me reading the notes I'm say and I say we some can pay attention. Just no they are called that. Yeah, for instance, say a brony who say be spot kitty on the skin now, or because you see and the dermatologist called back home. But you want to do for the whole spot be so and yes, you the tree. In general, if saying we don't pay attention to your health and it affects you a bit. Socioeconomic reasons and so many other factors also come into play. And now society you live in so medicine and kasana no biased against 2024. So Brunico Hospital and again socioeconomic reasons so because if you're Bruni no better than would into health insurance in the if you're now we low income person we need health insurance. But even crying if I say a brought for doctor Bruni doctor yare Bibini doctor yare. There is an implicit from cancer implicit bias be a cause attention remember Bruni any the same. A society a major flaw fact like upon deal say bad for corona by saying expose a lot of like biases or medicine against minorities. Those two broadly in a carbon everyone might necessarily say ɛwɔ tuntumfoɔ mu more than aborɔfo anaasɛ wɔ aborɔfo mu more than tuntumfoɔ but yɛn no kora yɛn kɔmɛ yɛn diagnose nti wo collect statistics na statistics no based on diagnosis in a diagnosis and sɛ na ɛbɛ diagnosis no wɔsɛ yɛ screening yɛkɔyɛ bi a studies imaging studies nti na bi a doctor no so yɛ bias a ɛnyɛ sɛ boapa yɛ pa o but ɛsɛ implicit bias no ɛyɛ ade a ɔno ankasa ɔnyɛ conscious of it nti bi a na ɔsɔ for other study bi a ɔsɛ wo de corner bra ɛkyina any those things no nti no nneɛma no keka bɔ ma na sɛ ama yɛn health outcomes no ɛyɛ as good as aborɔfo no.
Yo, where the doctor to many so what football be or the match for said the bet me any program. A football be or bet me the match for be a
football the match for na you can't be and say pay attention to your health. Your health no is the biggest offense investment I would my into who did ye exercise ye. So question about so when say fencing will be a stressful life the PR no abre we double on the end no like what is the essence say obey juma sa on rest na echi no bi akonya yade bi na yade leku like so who see we yes anima na it doesn't mean say won't mean nya but it decrease your chances say obet menya and I do a company winya so crampona body is in a position to like fight the disease, you know, and even recover. Until now, if you are the for
yo, Doctor, so on that note, you better was near Jao Quine. Now, so they can cancer in the best by next week and I did the own so about the so. If I say explore all the major ones, so that they are betting me my fair chance. Na yet me be a se be eba obetimi aso ano so de be ya ebeboa because the more na yet me ehunu ntem no the more na bia na your life no be a little bit better. Tina doctor to ebedo wase bebrebe.
Oh yo miss me damu nyina ase.
All right. See akwa drink krato ye ba no ane just said enu Muhammad just said wa tem why na sutin no tie. Muhammad when your best say is a Muhammad over 15 minutes. The Akadi man no. And the Nyakojo commercial the bar make it show 15 on track. Unya maso but Mr. warning. I'm going to see the wager of course. I'm going to see the wager. What did you say? When your best say Baba to be a man me. Minya no kwa can you quasi me but then watch him.
Just one more pic, JJ, please.
Oh, Mama. Really?
Smile. It's not every day my eldest son graduates.
I couldn't have done it without you.
All without Auntie Jane's generous support.
Here is to Auntie Jane's well-appreciated World Remit money transfers.
World Remit Corporation is licensed as a money transmitter by the New York State Department of Financial Services as a foreign transmittal agency by the Massachusetts Division of Banks, number FT1179663, and licensed by the Georgia Department of Banking and Finance, NMLS 1179663, Massachusetts Foreign Transmittal License, FT1179663.
World Remit, a better way to send money. Down.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Yo, that's it for some macabre bio. Safena do feeding at one my ready na so so wutie. Adwuma de ya to this health and wellness. I don't know so wutie. Yes. And I know you can pancreatic cancer ho asem na you can we na fe na de Mohammed's corner no so ebe bremo e Mohammed why lem no abaga so pekasa. And so abranche pekasa pa ye. Mohammed mayama akwaba emra akoready so. Na answer na oba no me na me catch us what time no say 10 minutes me gaza 15 is about 10 because no one can say you about 3 let just say about 2 na asa ya mo akwaba akoready Mohammed
me na kwame me joso me cha etiefo nyina nso
atiefo nyina nso
etiene se
so ehwe o so joso
etiene se me ko bi na man ka bi de enye ti manya 10 minutes a me help so na mabon tew se ne ebe ya emfa asembia ema na agosi ni mo ene ensem che opa metwen no mfichire o ensem say last week and some very quick one last week ya shede nwi na dia ebesisi ye say Ghana ye weather no ne ye network sem no ensem bebre
yes
na
yes
dia aka e wo se me de eba no minim say what me can very clear
loud and clear bibia e tene come up
yeah it say vaccines no kwa me say de aba bebre to the unim oman bi a omunya vaccines ni bia brana be hu ye na vaccines no pi na aba we have the men, you know, now we are having the vaccine and you know nyame adom ye obi e ho hyehyɛ na yeguso a ye ho hyehyɛ Johnson & Johnson bia no so no ebi nso aba in fact say no vaccines no apon unim say yenya ye no yenya be friend say yenya Johnson bia no 2 days pepe na AstraZeneca esande bi ba chow egu ho no chow ntino yeguso a ye kyɛ say no north ho no om de 11,000 doses and om de call north say obeka ya north first batch na din kan buy and am say na om ni expiry date no ewo edimu so obeka ya there was a time me catch us say Dr. Congo de na ye cover buy na date no ewo edimu ti de om de come north for no almost so eco cover buy because na date no enye so now AstraZeneca de no omanya 11,000 and na the previous Johnson & Johnson ye no so buy no ye 1,000 and almost so this new batch na aban from Tuesday or tonight na de chin ombesha sense na omo acheche sa batches no oko Bota region ene bonafo nso a bono ene ahafo region menganza because it's in yachim almost ni omodia e was say omunya no omonya but kwame so on say nipado na omanya cover ne Accra eni Kumasi enkran ni Asante into doses of course no region in Ghana can compare itself to the number of doses that yen yebinyana say Ashanti region in Krakow no ebenya there's no way say
of course our population here clustered into
sure
yeah
of course and then Kwame still no social distancing no eguso e wo form omo nche nose mask no e wo form to the extent say nansane ne endra Accra for instance omo no nche nose mask no ye chi omo na ye ma agenda 111 this was tribal a friend saying abubulushi ye mo kopra ho ekosiesi land no so to pave way for the district hospital. I think it was about 2 weeks ago that me can say punishment no ye man 2 days and I say 3 days wonder embwa so these things will be helping, you know, nansane na ye mo ko cleaning land nyina say ne be way so mo e di biba Kumasi na se Kumasi so mo sha say so mo yesa ebebo because onam proman ofo abo apeso bebia kegetie o wache moto we hifa bebia ni papi na enhye nose kwame say me see
o send me video bi kra na unam ni pamu ana wo show ana say video no about 10% of the people were wearing masks.
Yes, Kwame,
social
and
distances was zero.
Kwame, and I saw for once at the Biameka say, ye distance ye him for any suffer for free man, ain't me any. So I was say I suffer for no moment bother road more. But you get so many as suffer for one promo a preaching and suffer no moon engine nose mask. Just because it is perceived to say COVID no can still an almost engine. Kwame, we live in a country obi asade I was a on ye. It's been something I had been say, for instance, Obetana Kamu, Bedeba road accident, so Obetana Kamu. Now, Kwame, who driver say, or could be a car, and also Ako checking bonnet, and also checking BB or checking oil. Name as soon as driver better steer anymore, and not so far begin a canum a preachy. At the chase, and Yamin Fine could do us with you. But Yamin found we could do us with you, no tie, no can of time will be uncle. We live here when Yamina Ebeji Stiano. Na aka. Meanwhile, what do you have to do? No, one yet. So it's been something I say. I'm a road accident. I increase it. There be a road accident. I mean, back to the agenda. 111. So man can want some because me much in interest. Health game now agenda. But 111. Another say Ogusua OBC hospitals. Me catch last 2 weeks said there are so many hospitals. Yes, here we 100% complete, 90%, 95% complete. But yenkomu to the extent that there was, and as there is a district hospital, President Akucha Homamu say yenkomu. Me catch last week said room for a demonstration, and Sana district health director Ebeka say, oh, there's this training air course or say a training for training chrono de say orientation a be orienting for hospital. Say I don't know, I just don't know. Now no the data ba say on the 6th of this month, because our hospital no. Until no omobo the road say old district hospital no any active game. But the question people be na can is other than old one no omo nye renovation. No mo fanye nkora uma nkora nkum. Name we are going to abandon ye bijaya no amanaka. Na yasa akwe choked. It was a new one honor. I don't say watch bidia ni nyina no information we no enko ba ye betwan ama nipa bi abuof or ye betwan ama small boys no adidi atam ye beso camera si omo say aye nkofo ansa na they will be proactive. But me obeje di say Ashanti region ye wo military hospital kese wa a far a bit my funny patient about 500 people and I say 500 best and Koran so a bit my for me 200. So in all no a bit my for almost 700 patients. Hospital yes here we military hospital yes here we enwura na agiafa. There was Ashanti region enwura na agiafa. Oxygens esisim, air conditions sisim, plants you doom lighter plants in a bit so light their mind. Now the news has been trending, it's been going everywhere. Chromo for no asha say omo kasa. Kwame baby aye ken Ashanti region me kan wasem no. Konfanocha de bia me body no konfanocha e choked. Udu konfanocha unya baby e no wafa wo. Emergency in fact building na ankasa building na ankasa Kwame already me wo. Say there are some hospitals Kwame so wahia ura ho a doctor nyamfa ne nsankan as no utimi psychologically utimi nya ahode. But I'm sorry to say say cats bit back I say is 70% possible say would building next year one we unya gidi say na ya be ono kwa no ho ebeto. So it been idea had been say institutions na enye adwuma no I don't know say why na say say e was okay. This is why sometimes na agenda 111 nipa no bi ka say nana betimi nana ntimi media nkamenya nka obi throw challenge ma say hey kwamanu ako radio host no untimi nye. I think it's up to you to prove to the people say look I can do it, right? But yeah ha no de unya ka bibi unya kire wadwen ya say hey na the politics. We take everything to be politics in Ghana to the extent that asofo mpanifo no bi omo Ghana say almost say your friend is saying wow obeka say agenda 111 any possible be now you before
now Ibrahim account 2 minutes,
right? Oh, wow, over say agenda. One in your possible biano. Now, Kwame,
I see.
meanwhile, no, so for no, Nekasa Bequay, no, or say catch president say, oh, here hospital, when you went in hospital, you want the best hospital. I say, me and anypa, Ronano or Moka, say hospital, so we na we need. But some of us there, hospital now. Abindi yen yisika menum yusika enye abina ankasa sika ye minum yenu ye to ayitua ye bie hospital ye si hospital na bie na ye nkomu no eno no na eyi nipa dodo na issue a aya na ye wo ho adwendwen kwame unim say bono for region covid cases no about 27% of covid cases wo bono region omunya health workers eno si ade very alarming. Last week make I say me close nurses, close friends be omanya COVID. Ebinim were bold say omo ebe test no, but most of them na ankoye because omo colleagues na koye positive. So of course the same symptoms they na say positive. So omo rest, omo fa omo normal medications that was omo fa. So Kwame, even the health ministry.
No. I didn't so going back to work and I saw more isolate too.
Kwame, a lot of people. Why isolating? Kwame, ye nipa bebre test. Me catch you say ye nipa bebre test. A show positive. Ni a catch you say omunko. Obi ho crown so I am friend and can't share the say a positive and I say negative.
So what is the purpose of the test? Say the catch is when you are I mean because so we are testing now when the will be then. You know what mitigation I rule I'll be playing. Now no answer why the test no kind of been to uncle. I mean then test and so fast one say.
As soon as one is saying, Kwame, minimum crown, minimum nipa be 10 almost test a show positive. Near catch and so uncle. So back about 4 months ago, because a police officer be in a test for Western region. The same thing happened. No call came say. Madam, upon to anasa hon we do na a showman wakoto anase unyankoto. E no na e mani alarm me no. Nti COVID no it's more or less like ye the S as I am. Okay, nti me personally because of me what field into figures na e wo out no. Me who say it's more than that. E brosa because so many people and COVID figures no enyan kodru aban ho anase health ministry no. Enya endru
Rapono.
Right. Say
now for the freezer and fancy fridge more fashion freezer so the bay I say.
Kwame mate me the best freezer because don't say light no any very stable until me the best freezer say be do light in 2 days grana e beti equipe no yeah Kwame me can say week be ya me just some small minutes be at the mental health.
Yes.
Kwame mental health has been something ya tono asaram. And also, idea a hard dream pa say, most of the mental homes are and and then there be an idea say or more a see Jumnum Kwana about them. May can say a tear for I have for anyone Mobusian for Ghana. Say your best only will beat it, only will be only will be 2 animal. Nasa on the corner, a catcher said Sanhona boom. The corner, a catcher say. One who made the second will be one who are men funnel a because about 2-3 months now, a lot of people and out of 1 and a demand, but one taking serious. Okay, out of 1 and a demand on the Pacona one as or DBB, no. A kind bet you could suffer me for CC, you could for me. Meanwhile, Nanka auction who free any panwanka a beboa. Into me catch a Tiffany I have for say. Mental health and I say abodam and your ma at TSC a lot of people now very frustrated into the American and then the COVID-2 is real. COVID is very real. Say I was a nipa ronana if I make say aboche for move free na mo catch a fee for na omujidi pass and say ya wa na yes I can't know into you best say Chicago.
Yeah, that's
Right.
Promoto. Akwasi the mo kesi was starting. Me that's be. I nyambo at same time next week, you know. Yeah, be say about ho. Nyambo next week dey be about 30, be about 30 45 minutes na ja. They just freeze and na no dey about. But the next end is rough yen. Time na so.
Mene Dr. Baidoo. Di nkomo no say next week nyame adom a omba. Today, you know one pioneer dey meeting.
Come on, me na me dey nya wona no do. It's yeah, there was a baby. I therefore, I had never met a marriage to my Abba, Abyssina. Yaka pancreatic cancer once any doctor, Cletus Baidoo. The rest of Mohammed is also there, updates, you know, every Ghana, and also at the Abbey. Johnny Woods, also great show. Johnny, there was a baby. More commenting, more hair, more share, more young be my money cost. And the massive baby, of course, the conference is one who removed my friend's a producer, no, the canima is the Munasi. From the studios of Alco Radio, Musofu Kalmano, Makram.